Today we have the pleasure of speaking with Dr. Lisa Del Giudice, member of the Sunnybrook Academic Family Health Team and professor at the University of Toronto. Thank you so much for being with us.
Thank you.
Dr. Del Giudice, you are a special privileged witness to this strange, difficult COVID-19 era. What's your personal experience?
In the beginning, when this all started, I pretty much was in quarantine unless I was going to the hospital to see patients. I was not able to, I did not want to see my family. I did not want to see my parents. I did not want to see my children who don't live with us at this time, and was very much just sort of staying in quarantine, except when I had to go to work. So no grocery shopping. My husband was doing that. And mostly in fear of me infecting them, but also them infecting me and not being able to do my job.
Exactly. Dr. De Giudice, you are part of the cancer treatment unit at the Sunnybrook. So your perspective is really precious to us. There's a lot of, we understand that there's a lot of patients whose treatments are being put on hold, not only for cancer patients, but surgeries, heart disease treatments, because of this emergency. What can we say to these patients?
We can say that we're really working in the background to try and bring their surgeries to happen, to occur. I know that some patients have been put back on chemotherapy or back on radiation while they were waiting for their surgeries during this time. I know that as we start to open up the hospitals a little bit more, that we're trying to get them in. But unless we get the numbers down and unless we continue to try and beat this virus, that those surgeries, unfortunately, are going to have to continue to be on hold. So it's really important that everybody in our community understand that we have to bring those numbers down. We have to continue to social distance so that these patients who are waiting for their surgeries that have been put on hold can move forward. And they won't move forward until we're absolutely sure that those ICU beds will be available for them and those hospital beds will be available for them once they have their surgeries.
It's very interesting that you talked about social distancing, because we hear a lot of people that are stopping doing it and not social distancing anymore because they think the emergency somehow weakened and the virus doesn't have the viral power anymore.
Well, the power of the virus is still there. I think a lot of the measures that we've taken so far to date have really helped to bring those numbers down, have really helped to avoid the crisis that we were anticipating, that we saw in Italy and we saw in New York. But it's not over, and it's not even close to being over. And we are expecting a second wave. We may even be expecting a third wave. And right now, in regards to those patients that we were just talking about, we're going to try and squeeze those patients in before the next wave. And so when that next wave starts to come, we're going to have to shut down the hospital again. We're going to have to shut down those surgeries again. We're going to have to postpone them again. So we can't let our guard down right now. Things are not fully open right now. As you can see yesterday from the Premier's announcement that things are still closed. We're still in phase 1 to the end of the month. And he could extend that further, and that could mean that those surgeries will continue to be put off.
Dr. De Giudice, we hear about a lot of people, a lot of patients who, when it comes to their symptoms, they're procrastinating, they're holding off, and they don't call their doctors, they don't call the hospital because they are afraid of getting the virus. What's the message for these patients?
My message is to please call your family doctors, please call your healthcare providers or nurse practitioner, whoever it is that you seek care from, because we are seeing people presenting late. We know that we're seeing many less patients with heart attacks, strokes, new cancers, that they simply were not cured by coronavirus. We know that they're happening. We know that people are delaying coming, and we really need them to call their doctors. We're all open. So, a survey was just done of Canadian family physicians that showed that 90% are still seeing patients on a regular basis. Most of it's by phone. There's no harm in picking up the phone and calling your doctor. Your doctor may have to call you back, but it's really important that you call, because we know that coronavirus was not the cure to heart disease. We know that coronavirus was not the cure to strokes and cancers. So we know those things are still happening. We just haven't been seeing them, and it's very concerning. And when we do see them, they're presenting late. So we're seeing people who had a heart attack last week. We're seeing people who had a stroke 2 weeks ago that should have presented at the time and hadn't presented.
Dr. De Giudice, thank you so much for the time you dedicated to us and to our viewers.
Thank you.